Hello, this is Dr. Ted D'Amico, and today we're going to be discussing the fourth media and marketing research fallacy, which is that most segmentation approaches help in predicting brand usage. Many, if not most, segmentation approaches used with large media and marketing databases are not anchored to a specific consumer behavior. That is, they do not group people or segment people based on whether or not they use a given brand like Budweiser or a given product category like beer, or whether they travel to a given location like Europe. Rather, these segmentation approaches group people based on their overall demographic, psychographic, and/or behavioral similarities and differences. As a consequence, if one now tries to use segment membership to predict specific consumer behavior, one will find such attempts will almost always fail. There are three reasons for this failure. First, as just mentioned, the segmentation is not anchored. That is, it is not based on whether people engage or have engaged in a specific consumer behavior. Rather, the segmentation is based on overall similarities and differences among people with respect to demography, psychographics, and/or general behavior. Second, the measures used to segment people in these non-anchored approaches are typically non-predictive of not only the consumer behavior in question, but almost all consumer behaviors. Third, with non-anchored approaches, segment differences with respect to a given consumer behavior are generally small and insignificant relative to those which are found when an anchored approach is used. It is strongly recommended that if one wants to determine the factors that singularly and collectively best predict a given consumer behavior, one should use statistical approaches such as CHAID, which is chi-square automatic interaction detection, DFA, which is discriminant function analysis, or multiple or logistic regression. With these approaches, one starts off with the question as to why people engage in a specific behavior, have a particular illness, or use a particular brand, read a given magazine, or use a specific service. For example, if one was using CHAID or other anchored approach to determine why people develop cancer, one may find that the likelihood of developing the disease is markedly increased among a segment that is old, has smoked for more than 10 years, has a family history of cancer, and lives in an area that has a high pollution rate. In contrast, the likelihood of developing the disease is markedly decreased among young, non-smokers who do not have a family history of cancer and live in an area with little and no pollution. In conclusion, based on the prior discussion, non-anchored segmentation approaches should never be used to determine the reasons for a specific consumer behavior. Such an approach is antithetical to every scientific principle known to man. It is tantamount to grouping people on the basis of their religion and then trying to understand a multitude of consumer behaviors solely on the basis of people's religious beliefs. Such an approach may help you determine whether or not people eat pork, but little else.